Hello. I thought I would give an update of what's been going on. So many people reached out making sure I was okay because it took me a while to post an update yesterday. And then I didn't feel up to posting an update fully. But I am now. And feel free to hit like 2 times speed for playing this video because it might get long-winded. Now, I'm not going to do a recap of everything, so if you've missed stuff or you're curious, you can go back. Almost all of my videos are about this right now, unfortunately. But I will be covering the update on my insurance, covering a wound care doctor, finding a primary doctor, and why I went back to the ER. So my final dose of my antibiotics, because I was taking oral antibiotics for the MRSA, it was 2 times a day for 10 days, and my last dose was Wednesday morning. And then on Thursday, I took a shower, and when it came time to dress my wound, my husband and I noticed it was refilling again for the 3rd time. And this time it was about the size of like a like a clementine, like a little clementine. Excuse me, and it was red. And previously, the back of my leg was flat, like underneath you could feel the cyst, but it wasn't like protruding. And it was not red. And it wasn't hurting. I would put it on a scale of like 1 out of 10. It was like a discomfort if you pressed it, but it wasn't the pain I was experiencing like 2 weeks ago. So once again, we called the 24-hour nurse hotline associated with the hospital I was going to, and they said, well, you should see your primary care doctor within 24 hours for them to assess it. And I said, I don't have one because I can't find one. So they said, you need to go back to the ER. And I was devastated. I think I'm more devastated financially of what this is going to do. My husband is devastated because this infection isn't going away. It's funny how we're devastated over different reasons for me. But we went back to the hospital. I had the last 2 times I went, it was the same doctor. This time it was a different doctor, but one of the nurses was the same. And when she saw me walk in, she goes, why are you back? And they immediately took me back. Now, there was some question of like, why am I here? Like, it wasn't necessarily emergency worthy, but then they saw why it was emergency worthy when I explained that as of right now, I can't get to a wound doctor and I don't have a primary. I am stuck with how to take care if this infection is, I wouldn't say returning, but wasn't taken care of on the first round of antibiotics. So the ER doctor who was on call at that time, I will admit I wasn't a fan of, gave off just a vibe that wasn't the best. I preferred the other one. Because he said, well, you need to see a wound care doctor. And I said, oh, I totally agree with you, and I'm trying. And I explained what happened. He's like, well, you need a wound care doctor. And at first, I think he thought I was saying I couldn't find one because he kept repeating the one I could go to. And I said, my insurance doesn't cover any. So I said, so what's the next doctor I would see? And he just shrugged and said, talk to your primary. And I said, I can't find a primary. I have limited options on the insurance for our location, and a lot of them aren't taking new patients. And he's like, yeah, that's become a problem. I said, okay, so what do I do? Like, what if I can't find a doctor, or I do find one and it's a while before they can see me? He's like, well, then just keep hunting. I was like, well, great, thanks. So in the meantime, what do I do? So he looked at my leg. He's like, I don't see a medical reason to drain it. He was not in favor of draining it. And I understand it could just continue to refill until this is taken care of. So he said, it does, when he looked at like what the infection was, he's like, so the antibiotic is treating the MRSA. So it's a good antibiotic for this MRSA strain. based upon the culture. And I said, I didn't get a culture. I didn't get a culture when I came in the previous 2 times. He's like, then how are you diagnosed? And I said, the admitting doctor or the doctor on call said it's MRSA based upon how it looked. And this ER doctor said, you don't diagnose MRSA based upon how it looks. You diagnose it with a culture. And he was attacking. It made me feel like I did something wrong. And why would I, a civilian with no medical background, go, hey, culture me? So he's like, well, let me go check your records to make sure you weren't cultured. And I'm like, I think I would remember, but have at it. Enjoy. And he came in and said, yeah, you're right. You didn't get a culture, and I want to do a culture. He's like, but it's not going to be the best because it's already had antibiotic treatment. It could come back like with false information, all this stuff. Again, making it feel like I did something wrong here, where I just brought my little old infected leg in. And then he said, because if we call and it's because it's MRSA, continue the antibiotics, because he gave another 7 days of the antibiotics. He's like, it's helping. It just didn't completely take it away. So whatever you have might respond to this medication, but maybe you need a different one, or it's a different strain, or it's a different type of infection altogether. And then if they don't call, it means you don't have an infection, but just finish out the antibiotics. So hopefully we'll hear on Monday something. Although I got an email saying they don't call with results, you sign online. Even the hospital is giving me twitching. So they took the culture. She had to press down on the cyst because it also was back to pussing. I apologize for graphicness. So it's sore because then she had to go in with a Q-tip and take it. Again, no numbing. And then she rewrapped it, and I said, do I go back to wearing the leg brace? Because I was given a leg brace on my last ER visit to ensure I kept my legs straight and not bent, sleep with it, if I have to use it, to remember to keep my legs straight, walk with it, etc., etc. And she's like, well, what if it's rubbing on the cyst? Does it rub? I'm like, well, I have the bandage, my sweatpants, and then the brace. She's like, well, don't wear it so much if it's rubbing on it. Nobody ever said that to me previously. And then she said, but just wear it at night. Keep your leg free and clear during the day if you can remember consciously to keep it straight, and don't bend it. And then she's like, and you got to air it out. And I said, wait, whoa, nobody ever told me to air out the wound. She's like, well, maybe they didn't tell you that because it was open, but they should have told you that once it started scabbing to let it air out. Didn't know that. It's been scabbing. I didn't know that. So she's like, just do it once a day. Do it when you're changing it. Just let it air out. Lay on your stomach. Let the air hit it, and then bandage it up if it's closed. I was like, okay. And I said, so still keep it straight and keep off of it. And they emphasize, try your hardest not to walk, not to stand on it, not to bend. And I'm like, for how long? And it's kind of indefinite until I see another doctor. And that is driving me crazy and getting hard. I don't have a village around to step in. It's just not how it works in our life. So it's been difficult, to say the least, especially on my husband. And then they gave, in my discharge paperwork, there is a primary care clinic associated with the hospital. And they're like, call this number, see if any of the doctors there take it. And it's like a clinic, so it's not like MD Now, but it's like a first come, first serve, who's available doctor, so that I can get on the path of what's next with my leg. So bright and early on Friday, I called because I didn't want to run into the same thing where the wound care center closed at 1. And I called and said, hi, I would like to see if any of your doctors take my insurance. She's like, oh, we take practically all insurance. I'm like, great. So she goes, what do you have? And I tell her, she's like, well, we take them all except for this one. She's like, so does it say this on your card? And I said, yeah. She goes, well, we don't take it. Of course, the one insurance that they don't take Out of all of the insurances that this plan offers, it's mine. So back to square one of still no wound care doctor, still no primary. So then my husband took over, and on Friday was when we were supposed to find out from my insurance if my appeal was approved or denied for getting to see a wound care doctor, specifically the one that's associated with the hospital, but I'll take anything. Called, and it was still pending. The panel never even looked at it. And so my husband said, when will they? And the nice lady on the phone said, unknown. Could be a while. And it's recommended I find another physician to help with the situation who is on the plan until a verdict is reached. And I can't fathom this happening. And it was crushing. I would rather have an answer of no, you don't get to see the wound doctor, than we haven't even looked at it. We haven't even opened the file. So then went on the mission for a primary care, and my husband made a lot of phone calls because my appointments have to be based on his schedule, being a one-car family, and I can't drive. It's my right foot. I can't move my leg well, so I couldn't drive myself if I could, if we had two cars and whatnot. But so one put him on hold forever. One is listed on our insurance as being open, and they're not. 2 or 3 were closed already on the Friday when he called. 1 or 2 are not accepting new patients. Ran into that again. Finally found one who is like a big practice, multiple locations, multiple doctors. And she did a call. She called back and said, yes, we do have doctors who are taking new patients who take the insurance. So there's a bunch of online forms I have to fill out so they can best assign a doctor to help my specific needs, and then any other health, things I bring to the table. So yeah. So doing that this weekend so they can see that email in the morning on Monday, because we put in like the initial inquiry for new doctor that I preferably need to see somebody by next Friday, because this ER doctor also said you need to see a doctor before these antibiotics are up, so you don't get a lapse of antibiotics if you need more or something different. And I'm like, what doctor is going to get me in within like 6 days, no matter the circumstances? I mean, that's just not who we are right now as a country. You call and you can see somebody in 8 weeks, so I'm concerned about that. So I think that covers it in a nutshell, quickly-ish. It's just, I feel very stuck. I'm trying to help myself. Everybody is saying how important it is that I see the doctors I need to see, and I don't know how to. I had a friend say, pay out of pocket to see the wound doctor. And even if I did that one time, paid that fee, whatever that could be, any follow-up care I need, whether I have to go in weekly for treatment or I need a surgery by one of the doctors from the wound care center, none of that is covered. All of that is out of pocket for us. And it doesn't even go towards the deductible. It's just we're paying it. And we can't afford that. So that's about it. It's taking its mental toll on me. I'm used to fighting I fought for my parents' health stuff and won. Anything my kids need or my husband needs, make sure it happens. And the stuff I need, I can't fight and win and get. And that's making me sad. But anyway, I'll leave you with this little funny tidbit. At least I found it humorous. My blood pressure was high when I went into the ER the other night. My husband was trying to breathe with me to prevent a panic attack because it was setting in. And so my blood pressure was high. And before discharging me, they wanted to come take it again. And it was less, it was lower, but still high because of the conversation of what doctor do I see and a bunch of shrugs and don't know what to tell you. So I was still really stressed. And the nurse goes, yeah, for whatever reason, when patients come in, their blood pressure is always really high, meaning when they come into the ER. And my husband and my 2 kids were with me in the room. And my daughter goes, well, it's probably because they're nervous. And she's 5. And the nurse goes, yeah, you know what? You're probably right. And my daughter goes, yeah, I have a lot of doctor toys. But it was just interesting how the 5-year-old put together why patients might be nervous. They might be nervous, and that's why their blood pressure is high, or they're in pain. White coat syndrome, you just don't know. And this nurse was like, I wonder why everybody has high blood pressure when they see us in the ER. You gotta laugh so you don't cry. All right. I hope you're doing okay. I so greatly appreciate everybody's well wishes and their suggestions of doctors to see, and I appreciate all of you. Okay. I'll talk to you later.